Hi, my name is Brooke. I'm the nurse practitioner and I'm going to be doing your head-to-toe assessment today. Your bladder's been emptied, your height and weight have been recorded, and your vitals have been done. First, I'm going to start with your head and face, and I'm going to inspect your skin and your skull and your eyes and your ears for symmetry and external characteristics. Next, I'm going to palpate your scalp and your hair, your facial bones, your temporomandibular joint. Open and close your mouth for me. Okay, and now your frontal sinuses. Do you feel any pain or tenderness?
No.
Okay, and what about right here in your maxillary sinuses?
No.
Okay, moving on, I want you to clench your teeth for me. There you go. Close your eyes tightly shut. Okay, wrinkle your forehead. Smile. You can open your eyes now. Stick out your tongue. Okay, and puff up your cheeks. Alright, moving on to your eyes, I'm going to inspect your eyelids and eyelashes, your sclera and conjunctiva. I'm going to pull down on your lower lids. I want you to look up for me. Okay, and look down. Alright, I'm going to palpate your lacrimal apparatus. And now we're going to do your near vision testing. I want you to cover one eye and read the smallest line possible for me.
2843.
Okay, now cover the other eye and do the same thing.
374258.
Alright, very good. And distant vision has already been tested with the Snellen chart. And next we're going to do the cover-uncover test, looking for any strabisms. Okay. Okay, and next we're going to do the confrontation test. I want you to cover your right eye. Okay, and I want you to tell me how many fingers you see. Looking at my nose, I'm sorry, look at my nose. How many
2.
fingers? Okay.
2.
Okay, and I want you to cover the other eye.
3.
No, look at my nose.
3. 3.
Okay, now I want you to tell me how many fingers you see.
4.
Okay, now moving on, we're going to do the 6 cardinal fields of gaze. I want you to follow my finger, okay? Without moving your face. Okay, and next we're going to do I'm going to use my pen light and I'm going to look at your pupil response to direct, your direct and indirect pupillary response. Okay, and I want you to follow my finger. Very good. Alright, moving on to your ears, I'm looking at their alignment and placement. They look good, and I'm going to palpate your auricle on both sides. Okay, next I'm going to use the otoscope, and I'm going to look at your tympanic membrane. Turn your head for me, there you go. I'm going to look at your tympanic membrane and your external canal. I'm going to turn to the other side. Okay. And now we're going to do the whisper test, okay? So I want you to kind of turn to where your back's towards me. I want you to occlude one ear. I'm going to whisper a couple words and I want you to tell me what they are.
Blue book.
Okay, now do the other ear.
Brown picture.
Alright, very good. Okay, turn back around to me. And next we're going to do the Weber test, okay? So I'm going to strike this and place it on top of your forehead. I want you to tell me if you can hear it in both ears or better in one, okay?
Both ears.
Okay, and next we're going to do the Renee test, and I'm going to strike it again and place it behind your ear. I want you to tell me when you can no longer hear it, and then I'm going to place it outside of your ear, and you also tell me when you can no longer hear it, okay?
Okay.
Okay.
Alright.
Okay, and we'd also be timing this as we do it, and then we would repeat it on the other ear. Okay, moving on to your nose, I'm going to inspect your structure and your septum, and then I'm going to use my otoscope, and I'm going to look at your mucosa, your turbinates, and your septum. Okay, Then we're going to test for nasal patency. I want you to occlude one ear and inhale and exhale. And do the same on the other side. Okay. And then moving on to your mouth, I'm going to inspect your lips, your buccal mucosa, your gums, your hard and soft palate, and the floor of your mouth. And I'm also going to be inspecting your oropharynx area by looking at your anterior posterior pillars, your tonsils, your uvula, your posterior pharynx, and for your mouth odor. I'm also going to be inspecting your teeth for color, characteristics, and number, and your tongue for color, symmetry, movement, and characteristics, okay? So I want you to smile for me. Okay, your teeth and gums look good. I want you to stick your tongue out for me. Try and touch your nose, touch your chin. Okay, and then touch my finger from the inside. Okay? Alright, and then I want you to say ah.
Ah.
I'm going to be looking inside your mouth. Okay. So hold your tongue up so I can see the bottom. There you go. And then this is also when we have to do the gag reflex. I'm going to have you turn a little bit here so we can see the camera more. Okay, next we're going to move on and look at your neck. I'm inspecting for symmetry and smoothness and jugular venous distension, so swallow for me, please. Okay. And next we're going to palpate. So I'm going to palpate your trachea to make sure it's in the midline. I'm going to palpate your carotid arteries, making sure to do one at a time. Then I'm also going to come behind you a little bit and I'm going to palpate your thyroid in one lobe at a time. And I want you to swallow for me. Okay, and swallow again. Okay. And next we're going to auscultate. I'm going to listen to your carotid arteries with the bell of my stethoscope, listening for any breaths. Okay, I want you to inhale and hold your breath, okay? Okay, and exhale. And inhale again and hold. And exhale. Okay, next I'm gonna listen to your thyroid on each lobe. So once again, well, you can just breathe normally, sorry. Okay. And now we're going to test your range of motion and strength of your neck, okay? So I want you to turn your head from side to side for me. Okay, and then back. And then touch your chin to your chest. Okay, and next I want you to touch your ear to your shoulder. And other side. Okay, now don't let me press your face. Okay, and then this side. Okay. And next shoulder, shrug your shoulders for me. Okay, don't let me push them down. Alright, perfect. Next we're going to go to your back, so if you don't mind facing your back to the camera for us. Thank you. Next on the back, we're looking at his skin, making sure there's no rash, lesions, nodules, or anything. We're looking at the thoracic configuration, and we're also going to be palpating and percussing over the costovertebral angle. Do you feel any pain or tenderness here?
No.
And what about here?
No.
Okay. What about there?
No.
Okay.
No.
Okay. And next, while we're on the back, I'm going to go ahead and assess your spine. So if you don't mind standing up for me right in front of me. And there you go. First, I'm going to feel your muscles up here and your cervical spine. Okay, now I want you just to bend over and touch your toes. And I'm going to look for any curvature in your spine. Feeling all the way down. Do you feel any pain or tenderness?
No.
Okay, and stand back up for me. And I want you to rotate from side to side. There you go. And I want you to move laterally by trying to touch your hand to the side here like this. There you go, and the other side. Okay, and hyperextend your back for me. There you go, okay. And then you can sit back down with your back facing the camera. Okay, moving on to the lungs now, I'm going to inspect his back for respiration. And then we're going to move on to palpation. So I'm going to palpate for expansion down here. Lean forward a little bit and cross your arms. I'm going to have him take a deep breath in and out. Watching my thumbs move together and out. And now we're going to palpate for tactile firmitus, making sure to do it along the intercostal margin. So anytime you feel my hand on your back, I want you to say 99, okay?
99. 99. 99. 99. 99. 99. 99. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Alright, perfect. And moving on to percussion now. I'm going to percuss. Okay, and now we're also going to percuss for a diaphragmatic excursion. So I want you to take a deep breath in for me, and I want you to hold it, okay? Okay, and right here we would mark, you can exhale now. I would mark right here where I could tell his lung ended right here by it, by the sound from percussing. Okay, and now I want you to inhale, exhale, and then hold that. Okay, and then I would mark that too, and I would measure that to get a measurement. Excuse me. Okay, I want you to lift your arms up for me, and I'm going to go ahead and percuss your lateral lungs, okay? Comparing side to side. Okay, and lastly we're going to do auscultation on your back. I just want you to take a deep breath in and out several times here, and I'll tell you when to stop. Okay, I want you to hold your arms up. I'm going to do the same thing on the sides. Take a deep breath in and out. We're comparing side to side. Okay, you can turn around now to the front, please. We're still on the lungs. I'm going to inspect your front for your skin. I'm going to make sure you look symmetrical. And then we're going to palpate. I'm going to palpate your chest wall. Okay, I'm going to palpate your precordium. Looking for any thrills or heaves or pulsations. I'm also going to palpate your apical pulse. And it should be around your fifth intercostal space. And I'm also going to check for tactile firmitus. So once again, every time you pull my hand, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and now I'm going to listen to you. Once again, just a deep breath in and out. Okay, and next I'm going to listen to your heart, okay? So in your second intercostal space on your right sternal border, I'm going to listen to your aorta area. And then your left sternal border and your second intercostal space, I'm going to listen to your pulmonic area. Third intercostal space, left sternal border is Erb's point. And then fourth intercostal space, left sternal border is tricuspid area. And then fifth intercostal space, left sternal border is mitral area. Okay, moving on to your upper extremities, I'm going to assess your skin for rash, lesions, nodules. I'm going to check the temperature of your skin on your arms here. Okay, I'm going to check for skin turgor. I'm going to look for cap refill. Okay, and then I'm going to palpate along your clavicle, all the way down your clavicular acromion joint and your biceps and your triceps. And I'm going to come down here to your medial and lateral epicondyles and checking for epitrochlear nodes and filling of your radius and your ulna. And coming down here and palpating your carpals, your metacarpals, and your phalanges. Okay, and then the same thing with the other side. Palpating your bicep, your tricep, your medial and lateral epicondyle, your epitrochlear nodes, which I don't feel, your radius and your ulna, going all the way to your carpals, your metacarpals, and your phalanges. Okay, and I'm also going to feel of your radial pulse, your brachial pulse, and the same thing on the other side, your radial pulse and your brachial pulse. And we're going to test range of motion and strength. So I want you to bring your arms up for me and back down and put them out to your side here. Don't let me press them down and don't let me press them up. Bring them up here for me and back down, and then bring them back up and don't let me push them and don't let me push them. Okay? Now moving on to your abdomen. If you'll lay down for me, please. Okay, I'm going to pull your shirt up here to expose your abdomen. Next, I'm going to inspect a skin, once again for rash, nodules, lesions. I'm going to use a light here, and I'm going to be looking at contour, making sure I don't see any pulsations again, things like that. And we're going to start with auscultation. I'm going to listen in all 4 quadrants, listening up to 2 minutes at a time if I don't hear anything. The right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. And we're also going to use the bell of the stethoscope and listen for the aorta artery, the renal arteries, the iliac arteries, and a little bit further down here will be the femoral arteries. Okay, and moving on to percussion, I'm going to percuss in all 4 quadrants. Okay, and next we're going to percuss for the lower border. Starting at the mid-clavicular line, going down, I'm going to percuss until I no longer hear the dullness, and I'm going to mark that with a pin. And the next I'm going to start down here more toward the mid-clavicular line but by the umbilicus, and I'm going to percuss upwards until I hear the dullness, and I'm going to mark that and I'm going to measure it. Moving on to the spleen, to percuss that, you shouldn't hear any dullness with the spleen. I'm going to percuss over here. I don't hear any dullness, and now I'm going to ask him to lay on his right side. This way, if the spleen is enlarged, it'll move forward a little bit. I'm going to percuss again. And once again, I don't hear any dullness. Okay, can you turn back for me, please? Next, we're going to go to palpation. We're going to start with light palpation, making sure to palpate in all 4 quadrants. Okay, now we're going to go to deep palpation, also making sure to palpate in all 4 quadrants. Okay, and now I'm palpating the liver, and I'm going to place my hand up underneath here and underneath here, and ask him to take a deep breath in. Okay, and I don't feel anything. And now the same thing with the spleen, my hand placed under here, and hand under the intercostal margin, deep breath in, and I don't feel anything there. Next, moving on to the kidneys, place my hand underneath here, deep palpation, breathe in, and I don't feel anything. And the same thing on the other side, deep breath in, and I don't feel anything. Next, we're going to palpate for the aorta of the umbilicus, feeling the pulsations. And last, I'm going to have him raise his shoulders off the table, and I'm going to look at his abdominal muscles. Okay. And you can sit up now. Next, we are going to look at the lower extremities. Excuse me. We're going to look at the skin, the hair distribution, the